Welcome to this special edition of The Point with me, Li Xin. After China released a white paper on its fight against COVID-19, some analysts said it is an implicit response to criticism pointed at China for its handling of the outbreak in the early days. In the US, for example, when the number of cases there started to soar, the Trump administration started accusing China of not warning the US early enough. But the facts provided from China seem to tell another story. In our second episode of my interview with Dr. Zunyou, Chief Epidemiologist at the China CDC, I continue to ask him how China communicated with the US and other countries about the shared threat, even in the earlier days. You talked about talking to the United States. Indeed, on the white paper, it also said on January the 4th, the head of China CDC held a telephone conversation with the director of the US CDC, briefing him about the new pneumonia. So I understood it was a conversation, it was reported between Dr. Gao Fu and Mr. Redfield, who is head of the US CDC. What was the circumstances of that call? Was it a person-to-person call? Was there someone else with him? Did people know that he was calling him? What was said exactly? How many details can you tell us?
So after SARS outbreak, we set up a mechanism communication with the key partners. That including China CDC communicated with US CDC, and also China CDC communicated with Japanese CDC and also Korean. Since 2003, US CDC have office in Beijing. We have long-term collaboration. We have regular communication about emergency infectious disease and also other issues. For example, we have field training epidemiology. US CDC have long-term advisor here to help us.
So the first time they got information of this pneumonia, was it through this phone call or was it through their office here in China?
It's through the phone call and both. So we communicate. It's almost at the same time. Dr. Gao can contact with Dr. Redfield. That call, it's a person-to-person phone communication. That information just to send a message or inform the US CDC director. Here we have pneumonia epidemic, so we do not know the pathogen yet. We are working very hard to do investigation, making sure quickly to isolate or identify the pathogen. We'll report it to communicate with you and other countries. Also, it agreed to have continue technical collaboration on this issue.
Okay, according to the white paper, it says on January the 8th, an expert evaluation team designated by the National Health Commission identified a new coronavirus as cause of the disease. The heads of China and US CDCs held a telephone discussion on technical exchanges and cooperation. Was this the second time that they talked? And according to the New York Times, it says that in one grim conversation about the virus days later, Dr. Gao burst into tears. Was this true? Have you heard of it?
No.
It was according to the New York Times report. Yeah, and people wonder what could have been the circumstances that he burst into tears.
I do not know that issue. I think they do have the second conversation with US CDC that time, because the pathogen is clear. It's a novel coronavirus, and because the novel coronavirus transmits very fast, looking at the family of coronavirus, and the response will be very difficult. It's not easy to contain.
So can we say that actually since January the 4th, China has informed the United States
that
there is a pneumonia, and on January the 8th, China has told its counterpart in the United States that the cause of the pneumonia is a new coronavirus?
That's correct.
Also, according to the New York Times report, it says that China provided limited data, and China did not agree to an early attempt by US either Department of Health or the US CDC to send experts here to learn more. Can you give us some information as to this episode? Because we have heard the United States saying China did not allow us to come into China as early as possible, so we did not have enough information, in the United States.
I'm not sure. Even for us, we have limited data at that stage. It's very hard for us to share more. In the January 8th, that time, we even do not know it's person-to-person transmission. We do not know the future of the epidemic trends. So it's very hard for us to share data more than we have.
You just said that on January the 8th, China already know it was a new coronavirus, so it can transmit very fast,
right.
Potentially very dangerous. But by then, China did not say it could establish there was a human-to-human transmission. Mm-hmm. It took another more than 10 days for China to officially announce. Mm-hmm. Why so?
It takes time to collect the data to verify the hypothesis.
Because you already know it was a new coronavirus which could transmit very fast, and yet it took another 12 days for China to announce that this for sure was transmissible from person to person.
So at that stage, we know it's a novel coronavirus. It's in the family of coronavirus. Mm-hmm. We do not understand the feature of this virus, how that spread. Is that similar to SARS or similar to MERS? We do not know yet. We only know it's in the same family.
China's Supreme Court issued an article mm-hmm. concerning the cases involving Dr. Li Wenliang. Mm-hmm. Actually, in that article, it said that if Dr. Li Wenliang's warning to his fellow doctors could have been taken more seriously, there could have been some positive, or the impact of the virus could have been alleviated a little bit. Is that contradicting what you just said, that you needed solid scientific evidence?
So I think that information do help people to concerned or to collect more data quickly. That does not change the whole process, I think, because it's a novel virus. We have no prior knowledge about this virus, and we have no any literature recorded this virus causes a human illness yet. So all of this based on new observation.
In February, you also accompanied WHO joint assessment teams to 4 Chinese cities. What was the process like, looking back, and how important was this? The WHO was accused of being China-centric. They were praising China too much. What was your recollection of the events that happened then?
I joined the China WHO Joint Assessment Team, started from the preparation, and accompanied the team reached Beijing, Shenzhen, Guangzhou, and Wuhan. All the process, I think we did, it's transparent to all the WHO external experts. Whatever they requested to see, we shared all the information they want, and also we organized the site they wanted to go, particularly like Wuhan. We made
upon their request.
That's correct. So particularly Wuhan, we made a very, very special arrangement at that time. There's no transport to Wuhan. So that arrangement is very helpful for WHO experts to understand what is going on and what public health response took place in the local epidemic center.
What was your reaction? Because when Dr. Bruce Aylward, mm-hmm. head of the WHO head of the team, he was speaking very highly of China, but he was also criticized later for speaking so highly on China. What do you think of the kind of reaction that his assessment was getting?
I think what he expressed in the final press conference, it's representing all the WHO external team, all the team were impressed by our response from Beijing to Guangdong to Wuhan. All the sites they visited, they were very, very impressed. Particularly the community they visited. All the community are mobilized, are responded, and also Chinese scientific community worked very hard. All the scientific data and the questions they asked, we all provided timely. Also, all that data answered their concerns, their questions. So they have no any concerns in the China. What they concerned is, can China model be used in the other countries? So China is so powerful and timely responded to the epidemic so quickly and so thoroughly, and it's very hard for them to think about in the other country can respond. At that time, in the February, in the European countries, they have no big epidemic yet. They are concerned. Even this epidemic occurred in the European countries. No European country can respond like China did. So that was what he told to the public. It's really what he observed, and he was very, very impressed.
What do you think of the accusation that China was not transparent, that China was covering up in the initial stages of the handling of the crisis, and that if China had not covered up, the cases would have been less in Wuhan, and subsequently the number of cases would have been less in other parts of the world? Could China have done better in any way in the early stages of this outbreak?
I think what China did, it's based on the factor, based on the science. So as epidemiologist, I worked in the infectious diseases for more than 30 years. So I think China did the best. No other country can do similar like China did. Even in the European countries, even in the United States, the epidemic took off 1 month or 2 months later than China. They didn't control the epidemic like China. If we compare the 30 provinces outside of Hubei, no single province reported close to 2,000 cases. That was evidence China did the best in the world. If we compare the total population size, each of a province, just like a country in the European. So the number of cases in the China outside of Hubei is so small, right? So that means our strategy is correct. Our prevention measures implementing thoroughly, we successfully controlled.
Well, President Trump, just a couple of days ago in the beginning of June, he said the coronavirus was a bad gift from China. He said China, outside Wuhan, there were no big infections, but outside of China, there were a lot of cases. Was it possible, I think he was implying, that China let the virus spread to other part of the world by not stopping people from traveling, for instance, as soon as possible?
No, that's not true. In the China, in the January 23rd, Wuhan shut down, and also another 15 cities and go to Canton Sanitaire immediately followed Wuhan. That whole province, almost 60 million people locked down for 2 months. That limited the people, or maybe virus carrier, and move to the outside of Hubei and move out of China.
But what about before January 23rd? Because the virus was already spreading late December at least, right? From late December to January 23rd, there are about 20 days. Could the virus or carriers of this virus have already traveled abroad? And maybe that was the case. Could China have done something more back then?
It's very hard to make the decision to have a city over 10 million people, to have the city whole shut down. And at that stage, the number of cases are limited. And also the outbreak, the magnitude of outbreak is not that high. Even the lockdown will also get criticized from other countries, and like a European country and even United States, even experts, they responded. We overreacted. So make that decision, go back, look at the decision making now. I think it's timely and also it's correct.
Finally, this question about some professional papers that the CDC has published, especially at the early stages. There was this one that was published in the New England Journal of Medicine, where you kind of traced the earliest known cases of COVID-19 to somewhere December, early or middle December. And people are asking, if you had already had these cases, how come only at the end of December that they were reporting and you started to discuss and investigate?
Right, that's a very important issue, and we publish scientific paper. It's the reader, it's professionals. So usually the professionals, they understand this process. However, for general public, it's very difficult for them to understand. So as we discussed, the first initial identification of cases was Dr. Zhang Jixuan. That was December 27th. And that's the first time a doctor sees the patient. That does not mean the patient have first symptom occurred in December 27th. The patient may have the symptoms earlier than December 27. Could it be like 1 week earlier or 2 weeks? Earliest it could be 3 weeks. So what we reported, it's based on doctor's collection of recall the patient's statement when they have first time have onset of symptoms. So that day, it's record data is not really occurred. So that data may generate misconception or misunderstanding about, for Dr. Zhang Jixuan, she saw the patient on December 27th, but the patient onset may be December 15th. Does not mean she could recognize the issue in the December 15th.
Looking back, what could the CDC have done better?
As a team working in the China CDC, this time, I think we did the best in the world in the history. So look at the first 3 weeks. China made great contribution in the science. So in the first week, we isolated the virus. That's very fast. That creates the history of response to any infectious disease in the human history. And we quickly, only 4 days later, we developed a test kit. We shared the virus screen with WHO and other countries. Other countries can, based on the virus sequence, making diagnostic tests. And also in the first 3 weeks, we identified incubation period for the COVID-19. That's very important to make a control strategy. For example, we have quarantine close contact for 14 days. That's based on the incubation period.
But what could have been done better? What lesson, if there is one, that could be made?
So in the early initial response, I think 2 important issues, the bottlenecks, it's hospital beds, and also capacity for diagnose. And the test kits, if we could develop simpler, quicker test kits, that will save time, will make the epidemic diagnosis quickly and will be helpful. So go back to that question. I think we did the best so far. If, as epidemiologists work in the infectious disease for 30 years, no other country could do better than China. Even with our team, just repeat the past 6 months. It's very hard to make that time shorter. It's very, very hard because it takes time to respond to a new infectious disease. Even another infectious coming, it still takes time. You cannot do that just in one single day or just in 1 week. It's impossible.